Hello friends, this is Father Avinash Rodriguez. Today a question popped in my mind and it's a good one. Can a therapist have a close, intimate relationship with the client? Is it possible? And secondly, how can a therapist handle such situation? Let's find out in today's video. Yes, truly, a therapist can become very close to client. It's true. Studies say that 12% of the therapists become totally attached. They fall in love with the client. And it's possible. But it becomes unethical. Now, one thing you must know, a client's main job is to help, no doubt. He has to take care of the client. He has to see that he comes out of the problem. He becomes an integrated person. And once a client comes out from a problem, we should celebrate. All things is true. How can we make out that a therapist becomes totally attached? Sometimes therapist becomes, attached so much that he will call again and again. He will message again and again. When he is doing his work, he keeps remembering his client. And there he becomes totally attached to the client. And that something is very bad. Sometimes, even during the counseling session, a therapist tries to touch the client. And if that happens, the client should stop the sessions. So we become attached. We try to touch. Hi baby, how are you? And we try to touch. Now that's not good. And that will lead slowly into sexual tendencies. There's also a problem about transference. What do you mean by transference? The therapist tells, oh, you have that problem? I too had this problem with me. And he tries to impose his feelings to the client. Now that is called transference. There's also called as counter-transference. All these things are not good for counseling. So my dear friends, if you feel that you are sailing into the same boat, then you need to do something to resolve this problem. You can be a professional counselor or you can be a trainee. Everyone has to face these problems, wherein a therapist becomes closely attached. One thing you must do, if you feel that you are into this pit, then you must go to your personal therapist. Everyone should have a personal therapist. Go to your personal therapist. Discuss with the problem. Tell them your problem. And if you are emotionally, if you are sexually attached, express it and come out from this problem. Once a counselor's or therapist's name is spoiled, then it will be difficult for you to come into this field and practice your thing. It's going to be very difficult. So go to a therapist and help yourself. And lastly, if a client comes to you who had a relationship with you, don't have that relationship for the next 2-3 years. That's the ethical gap you must keep. It's only then you can do a session with your client. Otherwise, best thing, don't take that session. I hope you have liked this session or this talk. Thank you and see you next time. Bye-bye.